Our next speaker is Athanasios Theοχάρης. He is from the biggest association OKANA from Greece, which have different programs. And please, Athanasios, floor is yours.
Thank you very much for calling us and inviting us here in Belgrade. But before I start my presentation, I would like to share some good news that we have. As you all may know, we have naloxone in Greece, nasal naloxone, till last November, the November of 21. But 2 days before coming here, we have great news. We have nasal naloxone in field workers, in professionals of our organizations, but the Ministry of Health gave us the approval, the final approval, in order to have the nasal naloxone to peers, to families, to all the persons that may need. So it's very significant to put a tick milutin to that box and to finally have this ticked. So, just to say some things, as you know, in Greece we do not have an approved national strategy. We have formed this strategy, and it is not yet accepted, but it's in the approval process. And we gathered and we formed this strategy with budgeting, with targets, with aims, and with indicators for first time. And I have to say that we are the first organization that has performance budget indicators in our operations. So, in order to understand how big is our organization OKANA, as it's called, Organization Against Drugs, but I will tell you about that, that we have all the field of addictions now, and behavioral addiction, which is a new entry that we have. We have 4 main pillars covering prevention, harm reduction, and therapy, as well as reintegration. We have more than 9,000 beneficiaries, 20,000 in harm reduction, and 400 almost in reintegration. So when I went to the administration of this organization 3 years ago, we were almost 650 people, and now we are more than 1,000 people. So I would like to speak to you in another way, in a way of more operational, and show how this strategy may be in reality, which is much more, I would say, interesting and causing more motivation. So we tried to do all this expansion. We went to the addictions, and we went to low chains. So we have all the gambling, all the internet, all the alcohol, everything here. And we tried to implement and make reality all the NSRF programs that we had. We had almost 60 million funded by the EU, and we are now at the implementation of this project in 95%. And we try to fill in the gaps that we had in several points of our activity. You will understand how. So we have almost 130 services all over Greece, and more than 2,400 people for all the pillars that we have. The gap was there. The problem was probably mostly in the harm reduction area, where we had a gap in the hidden population, either more vulnerable populations such as HIV or LGBT population, and more, let's say, people like Roma and this kind of population. We had a high-risk population increasing in these populations, and we had many transmitting diseases, especially in Thessaloniki, that we have an epidemic, and we have to treat with overdoses. And of course, we had the problem with the immigrants coming to the country. So, in Athens, we tried to do more harm reductions, and in Thessaloniki as well. It was very essential that we had a very good contribution of the government, of the ministry, as well as the support of NGOs, of peers that were in the field. This is something that you cannot find everywhere. This is, for us, it was very crucial to have these people with us. Imagine that every day, there's no day that I pass the office of the minister, of the sub-minister, of the alternative minister, all the stakeholders in order to change their opinion, their concept, and this people-centric approach that we have in the national strategy that we want. We opened the DCR, we opened shelter day centers, we made many changes, and now these are, let's say, all these policymakers and politicians advertise this social policy because it's a kind of social policy, not only treatment. And the thing is that we try to convince them for this integrated system. The new services, the new entries that you can see, and the new services are much more than you can imagine. These are gathered here for the DCL for the inhaling kits. So you will see that we started giving inhaling kits till August 2021, because we saw that there is a trend on shisha, on crystal meth use that we have in Athens, and it's totally difficult for us. Imagine that we change our DCR, you will see, and we have injecting and inhaling room as well. We have the nasal naloxone, as I told you. We have two pilot programs, TTOs and Hippocrates. I will show you what they are, Escape and other programs. So imagine that this was a situation going outside, and we have distributed 8,000 inhaling kits, and last year in 2022 we had more than 600,000 cynics distributed. This is an enormous number. As you can see here, this is a totally different year. I wouldn't say years, but year, because this has exceeded the WHO average, and we are almost in 350 to 80 per person. I think that other 4 countries have reached this point. And this is only the beginning. And this has happened because lots of services have been implemented and have been developed, such as mobile units, such as social care and shelters, day centers, and things like that. We have this direct access and support unit for people who are coming directly to us, and they are treated at the first moment, which is very significant for us, because there you can have pathological, dental, and other testings that we can, and there we can find the first screening for HIV, HCV. So I can welcome you in the digitally our DCR in Athens. This is our new place with 12 seats, and if you can see, we have almost 20,000 visits, total visits for all the services for this almost 10 months, which is only for morning shift. We had an expansion of the shifts, and we will work 7 days per week. The government gave us the permission. And imagine that we have almost 1,200 per average per month, per day, per month, the supervised users that we have in the DCR. So we have all this. I forgot to tell you that we have almost 100 cases that we saved their lives with the use of monitoring and naloxone within this month. This is very crucial. And referring to naloxone, we had this in this situation in the field. So, new entries, shelters, day centers that we've opened, the biggest in Athens, 90 beds. We have other shelters as well. 2,026 people are benefited from July 2022, which is too many. It's 24 hours 7. We have other 3 in Athens, and we have other 3 in Thessaloniki and 1 in Patras. So 6 day centers and more than 1,500 beneficiaries. So the 2 programs that we should say a few words are TTOs and Hippocrates, Greek names, ancient Greek names. The one is for hepatitis, for HCV. It's the first program in Greece, I don't know whether it is in Europe as well, for beneficiaries of OST treatments. We screen them all and we connect them directly with the treatment in order not to lose in the way patients. So we took the patients with us and we brought them the doctors to them because we saw that the problem was there. And the other program, Hippocrates, is a program that we will have an automated system for HIV detection, since we have lots of HIV positives. Imagine that in our population, almost 70% of the people that we have are having HIV, and much more less are having HIV. Sorry. So it's of great importance that we cure this, and it's very easily treated now. So, escape project for the first time with the help of EMCDDA. We have it in Greece. We have it in 2 cities, in Athens and in Thessaloniki, where we want to give some emphasis because Thessaloniki has an HIV prevalence great, I would say. We might have an epidemic there. I don't know whether it is a pandemic, but it's an epidemic trend. So we wanted to do and to see what's going on there. So another pilot program that we had, that we faced during our work, is a pilot program with the immigrants. It was the first program that it was implemented in Greece for detention centers, because we saw that people who were arrested and went to detention centers, they were left again to the field and they were coming back and forward. So we try to give them treatment, we try to give them psychosocial support and to screen them in order to keep them within the detention center and not to go around and transmit diseases or sell drugs or whatever this might have. It is of great importance that this program, our Minister of Health has included it to another funding, and we will have a new project on this all over Attica. This is of great importance, and this is, I think, that our ministry evaluated all the situation, and we will take 30 million from recovery fund, from ANSRF, the next period, for the program that we have for public development, and we will have all this kind, all the naloxone project, all the streetwear action, and all the things that we want for the next period. So we have, as next steps, 3 mobile units that we will have in operation. We have 5 mobile DCRs that they will come probably in April in Athens. We will have 1 DCR in Thessaloniki, and many other programs that we will have. So the thing is that all this can happen. This is the thing. The only problem is that we have to insist. Thank you very much.